Okay, video 2. This is the second video in my gastric bypass journaling vlogging. So I already discussed in video 1 a little bit about what I was going to discuss in this one, and those were the pre-op testing fears, research I've done, who I've watched in the YouTube community, and why. What did I write? I'm sorry, I'm reading this off a list. Why I started in October of last year and why I'm just now coming back to it. So it's going to be, I hope, not a very long video because I know that can be very frustrating. So so my pre-op testing, in my opinion, I was more afraid of my pre-op testing than I was actually the surgery itself. Now that's different because it's done and I actually have new fears that have kind of taken over those, so I'm going to kind of lump my fears and my pre-op testing together. So I had a few pre-op tests that I had to do. I had to do some blood panels, which were like not normal blood panels, so I had to do a lot of different ones. So they had to do like 12 vials of blood, which was really not that bad because I've kind of grown immune to needles. So yeah, I had to do those. That was one of the first things I did. I had to do a chest x-ray. I had to do an I just had to do an abdominal ultrasound, which wasn't that bad. I think the most uncomfortable part is just lifting up your shirt to a stranger, and that was kind of uncomfortable, but it was a really nice lady and she was very supportive. A lot of people I've noticed that I've run into, and they have been in that medical kind of loop, they don't understand why a lot of gastric bypass patients do the surgery, especially if they're required to lose 10% of their body weight. They always ask, usually the question is like, why don't you just lose the weight normally and not get this surgery? So you will, if you haven't gotten this done yet, you will run into a lot of confusion from people who don't understand. Mostly from people who do not have weight issues, but there is a lot of people that do have weight issues that you'll run into that have those same questions. So, going back to, I'm off topic, my pre-op testing. So I had to do, like I said, the x-ray, the abdominal ultrasound. I had to do, okay, what is the other ones I had to do? I had to do 4 main ones. What are the other ones? I know the main one that I was fearing, and I think I forgot my 4th one. The main one that I was afraid of, oh no, I remembered, sorry. Back on track. I had to do a stress test, which was basically a ultrasound of your heart when it's resting, and then an ultrasound after exercise. And I had to get my heart rate up to about 180, 190 beats per minute. So I had to do about 8-9 minutes on the treadmill because I'm not really that in shape. And it's not normally like just a normal treadmill walk. You have to be on a really steep incline as well. The speed kicks up every, I think, 2 to 3 minutes. So that was hard on my legs, not really hard on my heart or anything like that. It was just my legs hurt. And that was pretty good. Like I said, uncomfortable thing is that there was a older gentleman that I had to kind of be very exposed to. So if you guys can request a woman, that would be the best, but I really didn't have the option in the matter. Like, I was really nice, so I didn't really have any complaints with that, but overall it was just kind of uncomfortable. It lasted about an hour, so it wasn't like I had to be there for 3 hours. Anyway, so my 4th and final major test that I had to do, which was the one that I feared the most, because I do take Motrin and ibuprofen on a regular basis because I do have a lot of joint pain. I have tendonitis in my shoulders, my elbows, my wrists, and my knees. And so I do take ibuprofen and Motrin on a regular basis. That is something you do have to quit after you decide to have surgery because of the fact that it does have blood thinners in it, and it's very ulcerating to your esophagus and your stomach. So that's something that you'll have to cut out completely, just to let you know if you haven't started this already. So I did tell the bariatric surgeon nurse coordinator, she told me that because I do take a lot of those, that I have to get an upper endoscopy. that procedure was more scary to me than any other thing that I had to do. So I went in around 7:45 in the morning. I thought it was going to take a while because they do have to put an IV in you because you're not technically sedated the whole way, but you are pretty much knocked out, kind of like if you were to get your wisdom teeth taken out. So I went in around 7:45 and I was really nervous. Like, I was really, really nervous. My blood pressure was up. Normally I don't ever have any issues with my blood pressure, but I was really nervous. So after, I think I only had to wait around for like 20-25 minutes. They wheeled me into the room. I was hooked up to my IV, and the room, no, I don't know, it's different for everybody. The room was fine to me. The doctor was really nice, Dr. Iqbal, and the nurses were really, really nice. I love Sutter hospitals because the nurses, I noticed, are really nice. Basically, I just remember they put some medicine in my IV and I told them I was dizzy, and pretty much, like, as far as like solid memories, that's all I remember. I do remember gagging a little bit when they put the scope down my throat, but it was only about the size of your pinky, so I mean, you swallow pieces of meat that are more than that. And I do remember, because they have to kind of pump your stomach full of gas, I remember that I remember kind of burping when they took it out. So let me show you a picture. I have a picture. So these are pictures of my upper endoscopy. If you guys are not really okay with like pictures of insides, it's not bloody or anything, but basically these are the pictures, if these will even focus. I don't know. There. So basically, it was fine. My fears were kind of not validated because it was really an easy procedure to do. It was very common, I guess, in many patients. So basically that was just a test to see if I had any ulcers due to the amount of ibuprofen and Motrin I was taking over the years. But I don't think there has been any issues because I haven't gotten a call back on those. So basically those are the main tests that I had to do. I haven't heard anything back negative from any of my doctors. My one doctor said I have low vitamin D in my blood, which I've heard is caused by the fact that I don't go out into the sun very often. So I just have to take some supplements for those, but nothing too bad. So I'm going to go on to the research that I've done over the years. I think I started this thought process on gastric bypass back when I was 16. I was always overweight, let me tell you, as many people are when they have this procedure, this surgery done. They have had weight issues for many years. I first started researching it back when I was on my father's insurance when I was 16. And back then, if you don't have financial support from your parents, you're not getting it done. And my mother had that mentality that if I wanted to lose the weight, I could lose it naturally. So I didn't, I couldn't go through with it. I started back thinking about it when I was 19. I still doing research online, mainly just doing a lot of reading. And I was really knowledgeable at that point, so I knew a lot about it. I still, oh, sorry, I lost my train of thought again. I'm terrible. I'm terrible. But again, at 19, it wasn't possible. So, I mean, I had insurance then, my own, but I wasn't making the income that I needed to make in order to support myself when I had to take off work. So, it wasn't feasible.